It's always special to be a part of National Health Center Week because there are so many incredible organizations that are really creating the safety net throughout our county. And this is an opportunity to showcase their good work, recognize the staff, and really celebrate the achievements that we've all made together.
For us, it's all about the celebration of community health centers, of health center organizations that are doing this tough work. Being in community health is rough. We're seeing underserved patients, patients with chronic diseases, and it's all about the empowerment of that we're all in this together.
If we can bring teams of highly qualified health professionals to the streets where people are camping, we're more likely to address some of those health issues and support services for people to address a range of substance use disorders.
National Health Center Week is just another way to really show our community the impact that community health centers can have on our residents, and having these resources and availability to people is one way that this week really gains exposure and helps people understand that we're out there and we're doing the work to really help people.
Community health centers provide vital services to some of the most vulnerable families in the Central Coast, and everyone working at the centers, from the doctors to nurses to administrative staff, you all deserve our thanks, and not just this week, but every day, all year long.
Health equity is something that's near and dear to your heart and something that I value as well. And making sure that our people here in Santa Cruz County are thriving, providing great physical and mental health care is so vital for our community.
One beautiful thing about Santa Cruz County is it is a community that is very small, very progressive, and very integrated in the way that it collaborates and works along with partners.
It's through community that we're able to help our patients. We understand that healthcare is beyond these 4 clinic walls. We have great partnerships with Dientes, and then we partner with other agencies as well. Encompass, we partner with Janice. We understand that we're all seeing the same patients in different settings, and we're here to ultimately achieve optimal health outcomes for our patients, regardless whether it's us, whether it's with Salud, whether it's with the county or any other agency.
So many people are focused on caring for the people of Santa Cruz County. We have a diverse patient population and a diverse county overall. And at our clinic, we serve everybody, regardless of where you come from, your ability to pay. And there's so many other organizations that have that same mission, whether they're healthcare, whether they address food insecurity, education, housing. There's just a lot of emphasis on coming together and bringing what supports the community needs.
Because it's not just ours to hold. Like, here, man, this is what we're doing. This can help you out. You got something cool too? Let me take that too, and I'm gonna use that too. Like, the more we share and collaborate with each other, I feel like it builds out, not just in Santa Cruz County, but it has ripple effects across the entire state and probably the nation.
We wouldn't be able to do our job without the collaboration of several nonprofits, community organizations, and other healthcare providers. We have a fragmented healthcare system, so in order to make it work, we rely on these collaborations.
I'm really proud to be a part of Santa Cruz County because we have such strong collaboration within this county. We work together. There's rarely a sense of competition. It's more about how do we work to bridge the gaps and to make sure that nobody's falling through the cracks in our community.
Dientes' impact is so much greater thanks to these partnerships and these relationships. And I think the only way we could really get this far is with our impact is through that collaboration.
The unique ability of the population, we're small enough, we are nimble enough to work together collaboratively for the best outcomes for our patients, and we're starting to see that.
By us working together, we can create a more integrated and equitable healthcare system for our communities.
Because people know when you really care, right? And you really are trying to help them out. And so I think those are successes, right? And I think those build relationship and community that has helped us be successful to the point where we're at.